Hello everyone. Please check the link on top of the video for the best weight loss solution on the internet. Before we get started, human growth hormone HGH does more than just cause the loss of fat. The typical weight loss programs today result not only in the loss of fat, but also in many cases the loss of body mass. With HGH therapy there is not only the loss of fat, but also the replacement of fat with muscle, which is why in some cases people actually gain weight to their greater advantage of the more sculpted body and better health. Human growth hormone actually recontours your body, which results in a younger and better functioning you. Once we get into our mid-30s, there is this evolution that accelerates from a nicely chiseled body towards more of a blob-like shape. Our lean body mass (LBM), including all of our organs, begin to shrivel, while fat mass, also known as adipose mass, increases. In fact, between the ages of 30 and 75, organs such as the brain, kidneys, liver, and pancreas atrophy by up to 30. It is now a well-known medical fact that this increase in fat significantly increases the risk for heart attack, hypertension, and diabetes, and even contributes towards cancer.The first long-term studies with HGH were done by Dr. Rudman in 1989 in St. Thomas Hospital in London on 24 adults with growth hormone deficiency. Half the group was given a placebo, while the other group was put on human growth hormone. After 6 months, those on growth hormone had lost an average of 12.5 pounds of fat and gained an average of 12.1 pounds of lean body mass, which was mostly muscle. The study would not be so significant if it was only related to the fact that the study was on those with diseased or removed pituitary glands, since this would only be limited to a few thousand people in the United States. The fact that is significant here is that this is indicative of a lack of human growth hormone, which almost everyone experiences as they age. Rudman's study showed that young adults with pituitary disease are the same as elderly men and women. Rudman did a 6-month treatment on men between the ages of 60 and 81, giving them human growth hormone. These men gained an average of 8.8 in fat mass. Also, their skin density thickened 7.1 and 17. In a follow-up study, it was found after 12 months of treatment with growth hormone there was additional increase, with lean body mass increasing by 6, skin thickness by up to 4, growth of a liver, and 23 acceleration in the rate of fat loss that was beyond the effects of diet alone. In fact, the latest studies from Sweden now show that growth hormone is the most effective treatment to get rid of the middle-age spread and all the disease conditions that arise with it. In the past 35 years, we've gone from having 1/4 of U.S. citizens being fat to 1/3 in 1982, now a majority of 2/3 seconds in 2004. Fat men have pulsatile release of growth hormone that is 3 times lower compared with normal weight men, and may 25 or more gain it back. In a 6-month treatment of growth hormone deficient adults at Sahlgrenska hospital, there was an overall 20 compared with 13 central deep layer body fat and 6.1 total body fat. The placebo group gained fat during the same period. Also, there was improved glucose intake, lower blood cholesterol and triglycerides, and lower blood pressure. Central belly fat appears to be the major culprit in producing insulin resistance. This kind of resistance, also known as diabetes type 2, is now in academic proportions in the U.S. and is directly related to obesity. Because HGH is so effective at sucking out this underlying gut fat, insulin sensitivity is improved and allows the body to get rid of the blood sugar more effectively. If you are now obese, HGH is a proven product for getting rid of your fat in the areas where it is so threatening to your health. In fact, it has been shown that using HGH will not only cause one to lose significant weight, but also to gain muscle and even look and feel decades younger. In older studies, it appeared that growth hormone countered the effects of insulin on the metabolism of glucose, which made people more insulin resistant. There was increased insulin resistance in patients after 6 weeks of treatment with growth hormone. However, 6-month studies show that insulin sensitivity returns to where it was before treatment. Also, large studies with growth hormone show there is no increased incidence of diabetes. This is because of the profound changes in body composition after 6 months, which induces greater insulin sensitivity due to the removal of abdominal fat. When you use growth hormone, it tends to direct the action of insulin towards putting sugar into the cardiac, muscle, and nerve cells rather than into the fat cells. Why in the world one go for things like stomach stapling and all the other crazy gimmicks which often have terrible side effects when HGH will do a far better job? A Belgian physician, Thierry Hertog, made careful body measurements before and after 2 months of treatment with growth hormone and recorded 23 to 30% shrinkage in the love handles of older people. Not only is there shrinkage of the abdomen, but that the underside of the thigh gets thinner, while the upper side gets thicker with more muscle. The belly buttons of most of his patients moved up by more than 1 inch after 2 months of growth hormone treatment. The skin that hangs from the upper arm of a woman is a signal of the loss of growth hormone. When a woman receives enough growth hormone, this hanging skin from the upper arm tightens back to a normal, more attractive appearance. Growth hormone increases the free fatty acids, which makes fat stores available for energy production. There is a process in cells called lipolysis. Fat cells have growth hormone receptors, and when growth hormone binds to these receptors, it triggers a series of enzymatic reactions in the cell to break down fat. Also, human growth hormone increases the overall energy expenditure so that you burn calories faster. Growth hormone is also believed to counter the effect of the hormone, insulin. Insulin acts kind of like the gate opener to allow into the cells glucose, amino acids, and fats. Growth hormone blunts the sensitivity of this gateway by opposing the action of insulin, which means far less fat is absorbed into the cell, and the cell is kept thin. Growth hormone also conserves nitrogen needed for the building of muscle. It also increases protein synthesis without increasing the breakdown of proteins in the cell. It is a well-established fact that growth hormone deficient adults that quit taking growth hormone have a significant decline in muscle mass and strength. Human growth hormone contributes significantly towards the building of muscle, and this has been proven in the study of many different groups, including athletes, healthy young men, HGH deficient adults, and the elderly.